Hey everyone, it's Doc.Barrak. Today we have a hot topic to discuss, which is about vaccinations in general and about the Pfizer and Moderna COVID-19 vaccines specifically. I'll also try and answer the most frequently asked questions I get about this matter. The information I'm about to share today is valid as of February 2021. However, it's subject to change if new yet conflicting data is presented. If and when this data is presented, you can be sure that you will hear about it from me in another video. So let's start. Vaccines are one of the greatest success stories in public health. Through the use of vaccines, we have eradicated smallpox and nearly eliminated wild polio virus. The number of people who experience the devastating effects of preventable infectious diseases like measles, diphtheria, and the whooping cough is at an all-time low. To ensure the continued success of vaccinations worldwide, it's crucial to make sure that vaccines are safe. Before vaccines are approved by the Food and Drug Administration, also known as the FDA, scientists test them extensively to ensure that they are effective and safe. And we continue to monitor them after the approval as well. Vaccines are the best defense we have against infectious diseases. But no vaccine is actually 100% safe or effective for everyone because each person's body reacts to vaccines differently. As infectious diseases become less common, we hear less about the serious consequences of preventable illnesses like diphtheria and tetanus, and more about the risks associated with vaccines. It's good to be informed about health choices, but the reality is that Americans have never been healthier and vaccines have never been safer than they are today. The benefits of vaccines far outweigh the risks. During the mid-1970s, there was an increased focus on personal health, and more people became concerned about the vaccine safety. Several lawsuits were filed against vaccine manufacturers and healthcare providers by people who believed they had been injured by the diphtheria, pertussis, tetanus vaccines, also known as the DPT. Damages were awarded despite the lack of scientific evidence to support vaccine injury claims. As a result of these decisions, liability and prices soared, and several vaccine manufacturers halted production. The NCVIA, or the National Children's Vaccine Injury Act, was enacted by United States President Ronald Reagan in 1986. It established a committee from the Institute of Medicine, or the IOM, to review the literature on vaccine reactions. This group looked into health problems to see if they were caused by the vaccines. The majority had no or inadequate research to form a conclusion. Specifically, the IOM identified the following problems with these injury claims. Number one, limited understanding of what exactly caused the adverse events. Number two, incomplete and inconsistent information from individual reports. Number three, poorly constructed research studies that didn't have enough people enrolled to form a conclusive link. Number four, inadequate systems to track vaccine side effects. And number five, very few experimental studies were actually published in reputable medical journals. In summary, it was noted that there was not enough valid data to claim that vaccines were associated with such adverse effects. Therefore, significant progress has been made over the past few years to monitor side effects and conduct research relevant to vaccine safety. And as I stated in my first video, the public needs to do a better job at identifying credible sources of information. So be on the lookout for an upcoming video where I will help you verify good sources of information that you can trust. So let's start with discussing evidence-based data about the Pfizer and the Moderna vaccines. The clinical trials that shed light on them involved more than 50,000 people in the US, with half being given 2 doses of the vaccine about 4 weeks apart. The rest just had dummy injections. Primary efficacy analysis demonstrated that these vaccines are about 95% effective against moderate and severe cases of COVID-19, beginning 28 days after the first injection. The majority of these COVID cases were noted in the patient population that received the dummy injection and not the population that received the vaccine. Efficacy, or how good these vaccines are in doing their job, was consistent across age, gender, race, and ethnicity demographics. Safety data milestones required by the US FDA for Emergency Use Authorization, or the EUA, has been also achieved. This data also demonstrated that the vaccine was well tolerated across most of the studied population with no serious safety concerns observed. The only adverse side effects that were greater than 2% in frequency were fatigue and headaches. So how do they work? Both the Pfizer and the Moderna vaccines are mRNA vaccines, which stands for messenger ribonucleic acid. It's basically a piece of material that contains instructions. Once it's injected, it's taken up by your cells. The mRNA contains instructions for your cells to make what we call spike proteins that match the ones found on the surface of the coronavirus, which causes COVID-19. When your cells present these spike proteins on their surfaces, your body recognizes them as foreign and develops an immune response, including antibodies that are specific to that spike protein. So the mRNA is just a temporary message. There are new vaccines that are also being worked on today. However, I'll wait for the data behind them to be validated, and then you shall hear about them in another video. All right, now that we've explained how these vaccines work, let's try to do it again using an illustration. So this over here is the RNA vaccine, or that small genetic code that kind of looks like a spaghetti. It's going to eventually be injected into your arm, and after that, it's going to travel through your bloodstream and then be identified by what we call a ribosome, which also kind of looks like a hamburger. This ribosome is a building block for proteins. So it's going to translate that RNA vaccine into what we've discussed earlier, the S protein, or the spike protein. This spike protein is going to eventually make it on the surfaces of your cells, very similar to how the coronavirus presents. And by doing that, it's going to trigger two types of immunity: the cell-mediated immunity and the antibody-mediated immunity. All right, now let's try to compare the two available vaccines today. And let me apologize in advance. It is true what they say, we have terrible handwriting, so bear with me. Both the Pfizer and the Moderna vaccines are examples of RNA vaccines, like we discussed earlier. The Pfizer vaccine requires 2 injections that are 3 weeks apart. The Moderna vaccine also requires 2 injections, a bit more spaced out, at 4 weeks. In terms of efficacy, both the Pfizer and the Moderna vaccines approach 95%. And again, efficacy is how good can that vaccine do its job. In terms of storage, the Pfizer is a bit problematic because it needs to be stored at -75 degrees and can only last for 1 week. What does that mean? That means you only have 1 week to inject it into someone before it goes bad. The Moderna vaccine has a bit more wiggle room because it needs to be stored at -20 degrees Celsius only, but can last up to 6 months. So in summary, these two vaccines are very similar, and I would advise that you take whichever one is available to you. I took the Pfizer vaccine because that was the one that was available at the time. I hope I was able to give you a quick overview of the science behind these vaccines and encourage you to take it. Let's try to end this pandemic together and get back to normal ASAP. Please feel free to add any question you have in the comments. Stay safe, and I'll see you soon.